Okay, so today we're doing a deep dive on something that you might think you know everything about.
Oh, yeah.
Listeriosis.
Okay.
And we're looking at a couple of sources, stuff you've probably seen before. Microbiology, the CDC,
Yep.
Microbe Canvas.
I've seen those.
But we want to look at those kind of less obvious details
Interesting.
that might even surprise, a medical microbiologist who's been doing this for a while.
Yeah, that's a great idea. I mean, I think it's really easy to get tunnel vision.
Yeah, absolutely.
When you do this kind of work day in and day out,
Totally.
you just start thinking, oh, it's the usual suspect.
Exactly.
You don't think about all the different possibilities.
Yeah, and I think a perfect example of that is like Listeria monocytogenes.
Right.
We all associate that with listeriosis, but have you ever seen in your work Listeria ivanovi?
Not very often.
Or Listeria gray?
It's rare.
Yeah.
But it does happen.
They can also cause infection, but yeah, it's much less common.
I think it's a good reminder, though, that we need to be doing thorough lab work.
Oh, for sure.
Even when you think like, oh, I'm 99% sure this is monocytogenes, there's that 1% chance that it could be something else, which could lead to, a misdiagnosis.
Absolutely.
And then a totally different treatment.
Yeah, that makes total sense. And that actually leads perfectly into another thing about listeriosis that can be really tricky.
What's that?
Just the different ways that it can present.
Oh, yeah. I mean, the symptoms.
Yeah. So you see, you can have like a mild gastroenteritis.
Exactly.
All the way to severe sepsis and meningitis.
It really runs the gamut, doesn't it?
Yeah.
Yeah, and that's one of the big challenges for clinicians because, especially early on, the symptoms, they can look like so many other things. You could be thinking, oh, it's just the stomach bug, or, oh, maybe it's the flu.
Right, yeah.
Really, it's something much more serious.
Right. Exactly. And so then you got to be extra careful when you're working with those vulnerable populations, right?
Oh, absolutely.
Like people who are older, or newborns, pregnant women, or anyone who's immunocompromised.
It's just so important to keep listeriosis in mind with those patients.
Yeah.
Because their presentation might be even more atypical.
Yeah, for sure. And actually, speaking of those vulnerable populations, these sources all really emphasize the risk to pregnant women.
Right.
And, it's not just about the mother's health.
Of course, yeah.
Like listeriosis can cause some really serious problems for the baby.
Yeah, it can be devastating.
Yeah.
Yeah.
Like miscarriage, stillbirth.
Premature delivery.
Yeah.
And then even if the baby is born, there's a risk of neonatal infection.
Totally.
Which can have long-term consequences for the infant.
Yeah, it's really scary.
It really emphasizes the importance of preventative measures in this population.
Absolutely.
Like making sure that expectant mothers know about safe food handling practices.
Yeah, for sure. For sure. And here's what I think is even more interesting.
Okay.
Especially from like trying to diagnose it, like some of these symptoms that can pop up.
Okay.
So the sources mention things like headaches, stiff neck, confusion, even convulsions.
Yeah.
And, you wouldn't normally think those are connected to like a foodborne illness.
Right. It's not the first thing that comes to mind.
Yeah. And so, those neurological symptoms, they could lead you down the wrong path.
Exactly.
When you're trying to diagnose it, right?
I think it's a good reminder that even when you see these symptoms, like meningitis or encephalitis, to still consider listeriosis as a possibility, even if the patient isn't presenting with, the classic GI symptoms.
Totally. And then to add to all of that, symptoms can take up to 2 months.
2 months? Wow.
After exposure. Yeah.
That makes things really difficult.
Yeah.
For both clinicians and epidemiologists who are trying to track down the source of an outbreak.
Yeah, exactly. It can be really, really difficult.
I mean, can you imagine trying to, interview a patient about what they ate?
Yeah.
And go back 2 months.
Right. Or even just from like an epidemiological standpoint.
Exactly.
Trying to trace back like, okay, where did this outbreak start? What was the source? Like 2 months ago.
It's a logistical nightmare.
It's a nightmare. Okay, so now for something a little different.
Okay.
Cutaneous listeriosis.
Right.
So this is not, like your classic foodborne.
Yeah, you're not going to get this from eating contaminated cantaloupe.
Exactly.
This is more of an occupational hazard for veterinarians or people who work with animals.
Yep.
And it usually happens after a listerial abortion in the animal.
Okay.
So it's direct contact transmission.
Gotcha. So, okay, we've got all these different presentations.
Right.
This long incubation period.
Yep.
And even like these unusual ways that you can get infected.
Exactly.
So it's no wonder that diagnosing listeriosis can be a real challenge.
It can be.
And the sources mentioned that you can try culturing from like blood or CSF for those central nervous system infections.
Right.
But it's not always like super straightforward.
Well, it's not a foolproof method.
No.
And even when you do get a positive culture, you can't just stop there.
Right.
You have to look at the whole picture, the clinical presentation, the patient's risk factors,
right,
all the other lab results.
Yeah, it's a lot to consider.
Okay.
Okay, so let's move on to treatment.
Sure.
We know the first-line antibiotics are usually ampicillin,
right,
offered with gentamicin.
Yeah.
But I'm curious, have you seen any patterns of antibiotic resistance emerging in Listeria?
So it's definitely something that we need to keep an eye on.
Okay.
There have been, a few isolated reports here and there, but thankfully widespread resistance is not a major problem yet.
Okay, that's good.
But we have to keep monitoring it.
Yeah.
Because the stakes are so high with listeriosis.
Absolutely, because even, with the right diagnosis and, you start treatment right away.
Right.
The mortality rate for listeriosis is still...
Oh, it's still high.
Yeah,
like 20-30%, especially in pregnancy-related cases.
Yeah, it's scary.
It really is. It's a reminder that we can't let our guard down with this bug.
Yeah, absolutely. Okay, so I think we covered a lot of ground here.
We did, yeah.
It's clear that, listeriosis is a complex bacteria.
It really is.
It can present in all these different ways that you don't always expect. And I don't know, for me, it just makes me want to stay on top of things.
Yeah.
Really question my assumptions.
Yeah, absolutely.
When I see patients, and especially when their symptoms are kind of puzzling.
I agree. And I think in our field, knowledge is power.
Yeah.
The more we know about listeriosis, the better equipped we are to protect our patients.
Totally. And that brings me to a final thought I wanted to leave you with.
Okay.
So we know it's hard to diagnose.
Yeah.
And it can have some really serious outcomes.
Right.
So what can we do as medical microbiologists to make people more aware of this?
That's a good question.
And, push for better ways to prevent it.
It's definitely something we all need to be thinking about.
Yeah, I think it's something really important to think about.
It is.
Yeah.
It is.